6:42 here on Morning Barbados. We've been talking to our doctor on the line, Dr. Adrian Lord. Please remember that you can call us on 228-5562 or 228-5563 or send us a message on Facebook or Twitter. We'll be following you there as well. Doc, we're coming up to the summer months. I want to talk to you about the little things that parents can do to prevent the inevitable ear infection, stump toes, whatever else. But we do have Brenda on the line, so let's welcome her to the program. Good morning. Welcome.
Good morning.
Hi.
Good morning, doctor.
Morning.
My question is, I have a pain just above my eyes, both of my eyes, to my temple and behind my ears, and then over my forehead, the center of my head. I drank Advil and it didn't work, so I don't know what more to do.
Well, I'm not sure what that could be. There are sinuses to the forehead, in the forehead, behind the ears, so it may be a sinus infection. If there's a concomitant runny nose, postnasal drip, fever, that could be a consideration. It could be tension, it could be stress bringing on those headaches, but you really should get it checked out and see what is happening. You've taken medication, a painkiller, and that hasn't worked. The pain has continued, so you need to use your common sense and see a doctor to have it checked out further.
And we have Oscar on the line as well. Good morning, Oscar.
Yes, good morning. How are you?
Very well, thank you. Are you well?
I am okay for now right now at this point of time.
Excellent. Go ahead with your question, please.
So, I have a young lady, and what has happened is with her is that she suffers from arthritis. So it's like she got the fluid, some of the fluid draw off from her feet, and she's happened to walk in properly on the same 2 feet. So it's like it gone right up in her wrist, as in the hand, and it's creating the problem as like it going dead. So she wanted to know what is it that she can take in order to prevent that there from being like that there.
Yeah, osteoarthritis is a chronic inflammatory condition, usually seen in the weight-bearing joints, but you can see it in other areas. You mentioned it's gone to her wrist, but it's not that travel from the knee to the wrist. You mentioned there was an effusion, there was extra fluid there that had to be drawn off, so it's obviously a severe case of osteoarthritis. It could be rheumatoid arthritis as well, or any other type of arthritis. But the treatment is the anti-inflammatory tablets, aspirin and any aspirin-like compound, ibuprofen, naproxen, diclofenac are some of the generic names of some of these drugs that can be used. If it is causing her fingers to become numb, as you mentioned, then there is some pressure of the fluid on the nerves in that area, and that suggests that you should seek the opinion of a medical doctor, orthopedic surgeon, or rheumatologist to see if there's something else that needs to be done on a continuous basis to prevent this from recurring or occurring.
We hear all the time, whether it's rainy season, the joints would act up.
Yes.
If it's too cold, the joints will act up.
Yes.
Is that true?
It is true. I can't explain it, but I can say that it is true. Several people do experience when the humidity changes, it does affect the joints. And my mother, who's 87 years old, good morning, Mom.
Mommy, go ahead.
Yeah, she can tell when we're having bad weather better than Pearson or not Pearson, any of the
men.
The Met persons. She can tell you when the rain is going to come long before it's predicted on the satellite.
But there's no medical test that says that is true, that is so. That might be more psychological than not.
No, it's not psychological. It's fact. It does happen. But as I said, I can't explain it on a scientific basis, but it does happen.
Interesting. Summer holidays are upon us, and I know Katrina, because of her brood, is very, very concerned about, some things that often occur during the summer.
They do. I mean, kids like to spend a lot of time either at the beach or at the pool or in a lot of outdoor activities. The summer months lend themselves to that. There's no worry about schools or whatever else. And I remember being at school, and my brother and I would come home with any number of sticks, jukes, jabs, worms, whatever else. Anything that you can tell parents to look out for, things that they perhaps might want to add to the first aid kit that they already have in the car or whatever else, because, you know, kids will be kids.
Yeah, you need to have some antibiotic ointment, antiseptic solution, some plaster, we call it, some bandages and so on, because these things will happen. Make sure your child is immunized, and all the children in Barbados who go to school have to be immunized, so that is not a problem with the tetanus shot that's necessary. Don't let them go to the sea if they can't swim, especially unattended, because that is always a problem. Let them go with someone who's senior to them, who can look after them in case there's anything. And if there's a problem, get it checked out.
All right, let's say good morning to Roxanne, who's joined us. How are you, Roxanne?
I'm all right. Good morning to the panel and good morning to the doctor.
Good morning to you.
Good morning. I was diagnosed with fibroids, and I want to ask the doctor a question. My doctor told me that he would have to cut my uterus and take it out because there's 3 small fibroids. But what I want to know if it is possible that you cut the uterus and take it out, remove them, or you expand the uterus.
Or expand the uterus?
The uterus and remove them.
Uterus.
Okay, the uterus or the womb, it's where the fibroids are, and depending on the size and your age and what your plans are, a decision can be made as to which treatment is better. Removal of the fibroids is called myomectomy, where the doctor would, as you said, surgically remove the 3 fibroids that he or she can see. Usually there are more that we cannot see. So that would only be happening if you're pretty young and you're desirous of having a pregnancy. If you are a lot older, in your 40s, and you're having heavy periods, painful intercourse, crampy periods, a lot of clots and so on, then the recommendation would be to have the whole uterus removed at that time. And that can be done laparoscopically if it is not too big. That's going through the small opening in the abdomen, and they can be crushed and pulled out, or surgically, traditionally, which they can remove the uterus.
You say what your plans are. You want to expand on that?
Well,
how it would determine the treatment?
Yeah, if you have no children and you want to have children, you need to have the uterus present. So if you are younger or in your late 30s and still haven't had that first child, the doctor may decide to just remove those fibroids, because the fibroids may be blocking the tube or blocking the cervix and preventing pregnancy, or causing you to have a miscarriage. So if that is the situation, then you would do that. If you're not desirous of having children, or if you are over the age where after childbearing age, then you decide you have the full hysterectomy done.